Hurricane Ian is triggering record-breaking storm surge for residents on Florida's west coast and increasing anxiety for their friends and family who are here in New England and beyond. Here with some advice is Dr. Michelle DeBlasi, who is a psychiatrist at Tufts Medical Center. It's nice to see you, Doctor.
Hey, Doctor. It's great to see you. So the power outages that we've been talking about in Florida right now are extensive, so it could be a while to confirm that the loved ones in Florida are indeed safe. So for many of us here, the blackout period is when we start to really obsess about all of the bad things that could have happened. So what are some ways to calm ourselves down?
You know, I think the biggest thing we can do is really just get, our thoughts out into words. Just get it off your chest, whether that's talking to family members, friends, your therapist, really about all your worries. That can be the thing that's the most impactful. Other things, you can do are watching mindfulness videos, meditation videos, or simply just distracting yourself with things you enjoy, whether that's exercising, reading, listening to music, or watching TV. We really just kind of need to get our minds off of such a stressful situation.
Doctor, a lot of people have parents or older relatives who live in that Fort Myers area. What do they need to know about the impact that severe weather can have on their mental health?
We know that severe weather has a massive impact on mental health. There's increased rates of depression, anxiety, post-traumatic stress disorder that can happen with the severe weather, and that's well studied and well documented. You have to imagine that, our loved ones and family members are probably undergoing an immense amount of stress. There's a lot of unknowns that happen in these situations, not knowing if your home is going to be damaged, your belongings, not knowing if your power is going to go out, if so, for how long. So all those can create a lot of anxiety. Additionally, people are feeling isolated socially, and we know that loneliness can lead to depression. So those are the biggest worries.
Yeah, in many ways you can feel cut off because of the weather, because the experts say that this emergency could last for days or perhaps weeks or maybe months, dare I say. So what are some questions that we should ask often just to make sure that they're still doing okay?
I think exactly what you just asked is what we should be asking our loved ones. Are you okay? I think that's the biggest question. Everybody at the end of the day wants to feel listened to, heard, loved, and cared about. So just, reaching out, showing them that we're thinking about them, asking them, are you okay? We're here for you, whatever you may need. I think that can have just such a huge impact in such a stressful time for everyone. We can be 1,500 miles away from our loved ones, but we don't have to be that far, emotionally. We can be there for them, and that's what we need to do.
It's really as simple as that.
Yeah. Doctor, thank you for your time.
Thank you, Doctor. We appreciate it. Stay well. And to our viewers, if you have any mental health questions that you would like our experts to answer, it's easy. Just email them to ask@wcvb.com.